So your comment about vision makes me think of an element of the essay, What Does ISIS Really Want, from The Atlantic last week, where the reporter had talked about the roots of ISIS, and he went to interview a jihadi in London. He said that no one really understood how great Sharia was because all they saw was the beheadings and the cutting off of hands. They didn't understand all the social justice elements of it, free public education, free housing, free health care. And the reporter asked the jihadi, but doesn't Great Britain already have free health care? And the jihadi said, no, a lot of stuff like vision isn't covered. So maybe that's the legitimate grievances that they have. Mr. Chairman, I'll start with you. So, I mean, as I've gone through some of the recommendations I've heard last week from a lot of folks at home, one point that you commonly hear is, well, we're going to have to pay for more. I mean, is it a fair characterization? Say maybe you're paying a little bit more, but you're also getting a lot more, and furthermore, you would be getting less for what you're already paying for if we proceed with the current sequestration policies?
I think that is absolutely correct, Senator Cotton.
Okay. I mean, other feedback from other folks on the panel? But when we're talking to the beneficiaries here, and they, in the end, just see that they have a higher bottom line, like what are the key benefits that you think we can tell them, like, no, this is what you're getting if you pay a little bit more, on a periodic basis?
Well, I would argue the mere fact that you take it out of the government contracting business and DOD contracting, and you don't wait you have a 5-year contract that's very, very difficult when a new medical procedure comes out of some kind to go ahead and modify that contract. That 5-year contract turns into an 8-year contract after the protest takes place. So in the 8th year, all those things that were brought to medicine in that 7-year period aren't available to the TRICARE recipient. That's why we've literally got people that we're putting together treatment plans for traumatic brain injury and post-traumatic stress at the NICO at Walter Reed. They go into the TRICARE system, and TRICARE, their insurance, refuses to pay for 50% of the things that are on the plan that we said that this particular service member needed to get better. That, to me, validates Admiral Giambasti's statement that this system is broken.
Other feedback? Admiral?
I would just tell you that you just look at the way the numbers keep going. Unfortunately, what's happened over the years is because we haven't changed the co-pays, because we haven't changed any of the fees, because they've remained virtually static, you've got to get money out of it somewhere, out of the system. So we keep changing the size of the sectors or the areas of responsibility. We try to collapse contracts. The DOD is working as hard as they can to make it as efficient, but ultimately what happens to this is you reduce the amount of available care to beneficiaries. You reduce the quality because the groups that are available to do this have shrunk considerably, and so therefore the system keeps eating itself from within, is what I would tell you. That's why I think it's in a desperate.
I would just like to add this. In the 1990s, after the first BRAC, and it was exposed that the military retiree really wasn't enjoying the freedom and liberties that they had fought for because they felt that they had to live in close proximity to a military base to access health care. Then the BRAC exposed them that, wait a minute, the government was about to throw them onto Medicare. Congress responded with TRICARE for Life. And when we did that, we essentially said to the military retiree, you're free. You can live anywhere you want in the country that you fought to defend. And it really changed the interdynamic of the military retiree, because now they can go live with their children and know their grandchildren. Better yet, when they go do that, and I'm a military retiree, of which I'm a military retiree, I look at this and say, I can actually access better choice, a greater number of highly qualified doctors. It's not written about in the press. This debacle that occurred in the VA on waiting times, the reason America got so upset about it was because of the integrity question. It really was. If you go in and you look at the inside of the MTFs today, talk to those soldiers and the families, talk to the wives. The waiting times for primary care and specialty care, shameless. So accessing this under TRICARE Choice, not only for the families, but also for the military retirees, that gray area retiree, we get them better access to care, increase their choice, and increase their quality. So that's what they get for a little more money.
Go ahead, Chairman.
And Senator, I just also add to this, and I think in terms of just summarizing it here in the three different areas, for the active duty family members, they get, for their money, there's no additional cost here, but they get a lot more in terms of choice, access, and so forth, as my colleagues have already said. And then for the reserve components, they get a lot more because, one, the cost has been reduced from 28% of their premium to 25%. So there's a cost savings there to them. There's a lower cost there. And in addition to that, there's no break in coverage when the reserve component member is mobilizing, deploying, and back and forth and so forth. They don't have that break in coverage that they would have under the current system, and so they're going to have consistent coverage during that period of time, which would be a much better value under the new on our proposed
Can I add one more?
recommendations.
The big winners that it really talked about in this are those that live in the rural areas. They're the ones who are the really big winners under this type of a health system. Because if you're subject to the TRICARE today and you're in a limited network, it's so limited whereby sometimes you go against your migratory pattern. We don't talk about that very often, but someone from a small town thinks that they need to go to a bigger town for better health care. Or if I'm in a bigger town, I need to go to the bigger city for better health care. In the TRICARE network, sometimes when they sign up a particular doctor, they may say someone in a town of 10,000 people, you got to go over to the town of 3,000 people to go get your health care. And it just drives them crazy. It really does. And this type of plan, we can access a greater, I'm sorry, I mean to point in front of your face, but you access a greater number of healthcare providers in rural areas, Senator Cotton, and that is a huge benefit in this plan.
I'll yield back.
Excellent question. Anything else, Senator Gilderoy?
No.
Thank you all. We will, absolutely.
Since there's no more questions. Is it your best estimate that beneficiaries in the system, even if they pay, in certain cases, pay a little bit more than they do now, still on average will be paying less than similarly situated beneficiaries who did not serve in our military?
Yes, in fact, they'd be paying less than what someone that was a part of a healthcare plan similar to FEHBP. They'd be paying less than those civilian employees that would be enrolled in that plan.
And that's everyone's in agreement on that point?
Yes.
Admiral? Yes. So one might say that in response to the point that we promised our veterans that they would receive a certain level of health care, and that would be a better or lower price care than civilians who didn't serve received, yes, this proposal is going to keep that promise.
Absolutely.
Yes.
Because today, someone of whom worked at a depot as a federal civilian employee is getting access to better health care than the service member in uniform, or in particular, not necessarily him, it's his family in the TRICARE network, because the TRICARE network is so limited. So that federal civilian employee is getting access to better health care for his children than the service member for theirs.
When you take into account the entire package of health care benefit, price, access, quality, so forth.
Yes.
And that the promise we made to our service members is that they would receive that package relative to civilians, not necessarily that package would never change in any way for the rest of time.
For the rest of time? Well, I don't know what that means, but for the rest of time. I do know for the military retiree, for example, they're very artful, okay, in their words that they will select, because I've been promised health care for life. I mean,
that's because soldiers are very artful and always have been.
You'll hear artful things.
No, but
they have had a tremendous benefit. They really have. Go ahead.
I'm just saying, if you look at the details of our legislation, one of the things we did was we saw that TRICARE used to be good, not so good today because of actions taken by DOD, okay? Because they need to save money. We turned to Commissioner Zackheim and said, bulletproof this. Set this legislation in a way that if we can get this through and get this benefit in the hands of these folks, that nobody will be able to do that. And he did. I won't give you the specifics of that, but he did in our legislation.
So my conclusion is, for that military retiree, when they've been at 5%, they were at 27%, right? And they're at 5% today. And we walk them up to 20 over 15 years. They are getting so much more value in a quality health system that their complaint is not legitimate.
Yeah, I mean, I think it's important that we all be prepared, Republican, Democrat alike, the commissioners, to answer these questions, because we will get those questions, and I think we're all in agreement that we all want the same thing for the retirees. We just have to be able to explain to them exactly how the new system will work and how much better the package could be for them, despite the discrete changes they see in their lives.
Senator, I think that it is fair to say, though, that the retirees and all of the travel that we did across the country in town hall meetings and to citizen sessions and public hearings and so forth, retirees basically, they told us that they didn't mind seeing an increase, frankly, in that cost sharing, as long as they got value for it. They wanted to make sure there was improved value for it, and I think that's what we have provided in those recommendations that we've made.
Thank you.